So when we have small muscle injuries, maybe by working out, maybe it's even a bigger tear, you usually know that you really hurt something, that it really is a legitimate strain. When you have this moment, you're doing something and you think, oh, that wasn't good. You know it instantly. You know, there's this one moment and you're like, ah, that was not good. Or maybe it's your arm, you've been curling too much and you already feel like it's kind of getting tougher and painful. And then there is like this one short moment and you really think, dang, what is this? So you know you got hurt. You pick something else up again, it really hurts in that area. The following protocol will get you out of that injury without the risk of re-injury. Because as you might have noticed, the older we're getting, the longer it takes to recover. And the way it was when we were like in our 20s, we just ignore it for a little bit and it's fine again, and we can just pick up right where we left off. It's not working anymore, right? So here's a protocol how you can recover without re-injury. Now let's say you hurt your arm. In the very beginning, it does make sense to put some ice on, but we know now that in the long run, ice hinders healing. Because it's vasoconstrictive, that means the blood vessels are actually getting smaller and you have less circulation in the area. So you really want to use ice maybe in the very beginning for the first few hours, on and off. Don't keep it on for too long, just in order to reduce the swelling a little bit and numb the pain a little bit. But from the start, you already want to move carefully. Now, if it's an arm, it's easy. Just don't carry anything. Go through the range of motions carefully. Make sure that you don't trigger any sharp pain. In these first few days after an injury, it's really tricky, and you want to make sure that you let the tissue heal without pulling on it. Don't ever let anybody tell you have to stretch it out. You really don't want to add any stretches until you're way further ahead with healing. Imagine it as if you have a cut like in your skin. Imagine you have a cut right here. And every time you open this hand, this is going to come open again. This is going to start bleeding again. Now, with a muscle injury, you don't see any blood. Imagine the same thing is going on under your skin. You don't want to stretch this. You want to stay within the range of motion that is comfortable. Don't completely immobilize, but be very, very careful within the first few days. The kind of principle that you want to apply is you move around the pain and not through the pain. So don't get it in your head to just push through. Use the pain as a guide, carefully move around, and don't add any weight at all. If it's your arm, just use the other arm. If you need to, put a bandage on, even a brace, something that reminds you, because some of us, we just forget, and then it's like, oh no, there's that thing again. So try not to carry anything. If it's your leg, allow yourself to limp. Go very carefully. Try not to trigger the pain at all. Now you've been doing this for a few days. You've been moving around. You made sure you go through the range of motion. You let yourself be guided by the pain, and you notice the pain is already better. This means you don't need to go to a doctor. You can continue healing by yourself, but carefully. Now pay attention. If it's your arm, start carrying little things. Start with a coffee cup. And it's still the same principle. You let yourself be guided by the pain, but you're already adding a little bit of weight. Just a little bit. Be very careful, and you can always check in. How does it feel the next day? So if today, for a few times, you were grabbing little things, you were getting a little bit more active, check in the next day and see, okay, is this hurting more or less? If it's hurting less, you know you're on a good way. You know you can continue. Now, if this really was a simple injury, you've been moving around, you started carrying little things, or if it was your leg, you just started walking a little bit further, and you didn't notice that it got worse the next day. Actually, it's been getting better. Well, then you know you can just continue this way. Each day, add a little on, and you're going to be just fine within a week or so. You know this was a very small injury. You're going to be okay. I would still like you to pay attention for the next 3 weeks. Just give it some thought whenever you feel like that injury is getting triggered again. Pull yourself back, and please, for these 3 weeks, don't do anything sudden. Don't do any super hard workouts that affect that area. Just keep in mind, if you're going to open that wound up again, if you're going to tear that open again before it's completely healed, that's going to throw you so far back. So be patient, but continue adding on if you feel like you're getting better each day. Now, if you've noticed that you had to lengthen the process a little bit and you started working with little things and that was fine, but as soon as you started carrying something heavier, or if it was a leg or a hip, you were walking a longer distance, it started hurting again, you know you have to move backwards in the process. You know you just have to repeat the area where you're hardly adding any weight, where you're kind of limping around carefully, and check in how you're feeling the next day. If you stayed really well off it, you just went through the range of motion without any weight, and you were getting better, we're good. When you start getting worse, maybe it's really time to see your doctor. Now, let's say you're working well with it. You feel confident. It is a slow progress, but you can add on little by little. That probably means that it was a real injury if this is over a week ago now. But you feel like you can add a little bit, you're brave enough, so you can start working out. Do some strength area exercises for the affected area. You can really start slowly if you're used to going to the gym or other activities. Work with the ones that used to be easy before you got injured and do them very slowly and only a little bit, like maybe 10 minutes a day. And always check in how you're feeling the day after. Now, through this process, you might have noticed a few days that it actually felt a little bit worse. That's always when you go backwards a few steps and you just really take all the weight off. And when you're starting again, you start even more slowly. You really want to make sure that you don't keep injuring the same spot. Because what we're going to get when we have these recurring injuries is that eventually the body remembers the pain. You're getting more and more sensitive. Also, you build up more and more scar tissue and it causes all kinds of other problems in the long run. So avoid this re-injury. And when you've noticed that you got really worse for a while, you have to step way back and start so much more slowly. So it's never a bad idea to just go back to saying, okay, I need to let this heal first and just take a break. Stay away from it for 3 or 4 or 5 days. You're going to notice little by little when you always check in the next day how you're feeling, whether you can add on a little bit. But let's say you're at the point where you've been adding some strength training, you're getting more and more confident, and it is fine, and you've been at this for 2 weeks now. This is the time when you can add some stretches. And I really would like you to wait for that long, because just imagine you're pulling on the tissue that just about knitted together. You want to be very careful in the beginning. So when you start doing stretches, you will notice the affected area is shorter than the other side, is shorter than it used to be before. And just like with the strength training, once you start stretching, start very slowly. Make sure you don't trigger the pain and check in how it is the next day. Now you've been doing your strength training, but you stayed careful, you didn't do anything overly strenuous, and you added some stretches. You were still always checking in how you're feeling the next day, and you slowly added on more and more. This is a great time to bring in coordination because the tissue that had to heal really confused your nervous system, and the maps in your brain that show clearly what is in which area, which limb are you targeting, which muscle is twitching. Those maps need clear information so that you really can heal completely. And it's not only the muscle, but also your nervous system. So start doing a few silly things. Start doing some balancing exercises. Do things that cross your body from one side to the other. A really nice thing to do at this point, if you had an arm or shoulder injury, is trying to do some juggling. Try to do little things that are confusing, surprising. Maybe you want to take some dance classes if it was a problem with the legs. Maybe you want to do some martial arts training. So think about creative ways that you can challenge your balance, that you can do things that cross over the midline, and do a few brain exercises. So we've been doing the strength training, and then we added careful stretches, and then we did all this coordination stuff. Maybe you also try to just use the other hand more frequently, because while you were injured, you had to be a little bit more ambidextrous. So keep that up. I mean, when you're doing little things like pour yourself some water, do it with the left hand, do it with the right hand. If you're super brave, try to brush your teeth with a non-dominant hand. Careful, don't poke your eye out. But those kind of things are really good for you to get the nervous system to correctly map out the whole area so that you can heal completely and that you don't have this lagging problem that often people have after an injury. Now, you can get back to normal training if you made it so far. Stay vigilant, keep it in mind a little bit. Of course, don't get paranoid, but it's always better when you feel like this old injury coming back that you just back off a couple of steps, maybe get a good massage for the whole area to just help with the scar tissue so that you keep your good mobility. Stay fit. Thank you.